Okay, this video is about what's the difference between medicine and sports. I was an athlete in college. I know a lot about what it's like, and basically, it's pretty straight. You try to train, you try to compete, and everyone has the same goal. The coach wants to win, athletes want to win, the fans want to win. Um, Everyone wants to win. And every team publicly will post its win-loss record for the team, for the individuals, their statistics and whatnot. And it's easy to tell how good a team is, how good an individual's doing. In medicine, it's complicated. The patient wants to win. They want to get better. The doctors want to help the patient. They devoted their life to learning how to help patients, but they have to be productive. And productivity often means quantity rather than quality. They've got to make money for their hospital or their clinic, whatever it might be. And now if a doctor number one just focuses on writing prescriptions, he can see about 30 patients in one day. If a doctor number two tries to teach the patients, to empower them about vegan diet, for example, low-fat vegan diet, he'll only be seeing about 10 patients a day at the most. And he will probably get fired for not pulling his weight. They'll get labeled as lazy, only seeing 10 a day instead of 30. Doctor number two would be like a Dr. McDougall, for example. He's likely to get ostracized, as McDougall was. They wouldn't send him any patient referrals other than themselves or their family members. If a patient becomes vegan and gets cured, then no one makes money off of them. They don't need to take any pills. They don't need laboratory tests. Now, a pharmacy really only makes money if the patient takes a pill every day. It's not in their interest for the patient to be cured. Patients who are cured don't take pills anymore. The pharmacy makes money by managing the disease, but not by curing the disease. In sports, there's always a little bit of BS, especially at the professional level with some athletes taking anabolic steroids. In the health world, it's much more complicated. There's a lot more stuff going on. Big corporations, they can just buy the journal. They can buy the scientists to do the research, buy the results, not publish stuff that doesn't promote the product. So an industry-funded study, it virtually always promotes the product. Now, further going on with what's the difference between medicine and sports, I've never seen a hospital publicly post its cure rate for chronic diseases. And by definition, a chronic disease never gets better. It's like a team that basically says, hooray, we never cure anyone. Hip hip hooray, we're the best. We lose every game. The cream of the crop. Go team go. It's ridiculous. And whereas, vegan diet can cure a lot of stuff. I mean, some things it can't, obviously. The more chronic something is. Typical standard treatment is going to be with pills initially and eventually surgery. And just to see how common this pattern is, arthritis, treated with analgesics, then steroid injections, then a joint replacement. Impotence, treated with nitric oxide enhancers, then a penile prosthesis. Coronary artery disease, going to be treated with medications, then a stent, then open heart surgery. Autoimmune diseases like Crohn's disease, for example, treated with pills, then potentially surgery. Bowel resection for a Crohn's disease patient. Diverticulitis, treated with percutaneous abscess drainage, then eventually sigmoidectomy, resection of part of the colon. Arrhythmias, treated with antiarrhythmic medications and anticoagulants initially, then with transcatheter ablation, then with a pacemaker, eventually potentially a heart transplant. Peripheral vascular disease, treated with thrombolysis, angioplasty stent, then eventually with amputation. The point I'm saying is this is the standard pattern of disease treatment. Cataracts with glasses first, eyeglasses first, then cataract replacement surgery. Depression, with depression medications first, a form of chemical lobotomy, potentially, then with eventual electroconvulsive therapy, a form of potential electrical lobotomy. Okay, never mind that each of these diseases is potentially, not for certain, but potentially, preventable or treatable with a low-fat, low-sodium vegan diet.